Good afternoon or good morning, depending on where you are right now. Thank you for joining us for our first ASA Live of the new year. We're excited to be back with these again after a small hiatus for a few weeks while everybody was hopefully enjoying their holidays. Um, I am Cindy Morris. I'm the Vice President of Development and Community Engagement at the American Society on Aging. And today we are talking with a couple of people here that are really here to talk about U.S. aging and some of the work that they are really doing. So I want to start off by introducing Beth Blair, who is the Senior Research Associate at U.S. Aging. Welcome, Beth.
Hi.
Um, Hi there. And Bob Graham, who is the research scholar at Scripps Gerontology Center at Miami University. Thank you for joining us, both of you. CBOs across the country are contracting with healthcare payers and providers to address social and behavioral determinants of health. This AFSA Live today is discussing insights from the Aging and Disability Business Institute's newest survey on CBO healthcare contracting. Dr. Graham and Beth are going to be talking about the trends in healthcare partners, services delivered, challenges, and more. For those of you who follow ASA Lives and have been with us over the past couple of years on this now, you know that I'm learning with you. And learning about this has been one of the things that I have found fascinating over the last year or so. And one of the ways that I have learned about this is through the webinar series that US Aging does with ASA. This coming week, we have one. It is January 25th, Primary Care at Home, how one area agency on aging is bringing back the house call. It's funny, I actually just recently read a piece in the AP about the reemergence of house calls. So I'm excited for this webinar. But we will be, this kind of continues on with their trend in which we really talk about healthcare contracting and about how community-based organizations work within that scope. So thank you guys. I hope you all will join us for the webinar. This is going to give you a taste of what that experience is. And so we hope that you'll join us next week on January 25th and again for their monthly content. Let's start here to both of you. What trends are we seeing in contracting right now?
So let me talk about that. It's really been exciting to see what's happening. Scripps Gerontology Center at Miami University has had the privilege of working with US Aging and the Business Institute on tracking contracting and seeing what's happening with that. And what we've been doing since 2017, we've been tracking that. And what we found is that it has significantly increased from 2017 until last year and this year continuing. We've had, it was about 38% of CBOs reported that they were contracting, and that's increased to about 44% last year and this year. The percent that are not contracting but are pursuing has declined. So there was a higher percentage of CBOs that were not contracting but pursuing, and we assume that that is because that the drop is because many of them have been successful in contracting, as we've seen the percentage increasing in currently contracting. The percentage of not contracting and not pursuing, so those CBOs that for whatever reason are choosing not to pursue at this time, that has remained fairly steady, about 44 to 45% throughout the years. So that's what we're seeing with the trends in contracting.
Interesting. And how do these services provided in contracts differ by, healthcare partner type? How are you kind of seeing those services play out?
So on the survey, we ask about a lot of different types of healthcare partners, but we do have the opportunity to follow up on services provided for, I believe it's 5 of them. And we focus in on Medicaid managed care, duals plans, Medicare Advantage plans, ACOs, and hospitals and health systems. And we ask the respondents follow-up questions about what services they're providing specifically for those partners. And so there's a lot of there are similarities and differences. The most common services provided in general are, well, it's assessment and screening for social determinants of health. And so we see that appear for a number of those partners, just because it's the most common service in general. And the same is true for case management. But we do see a few differences. For example, nutrition programs such as meal delivery are in the top 3 or so for accountable care organizations and Medicaid, Medicare duals plans. And we also see evidence-based programs such as the chronic disease self-management programs and other things of that nature with Medicare Advantage plans and hospitals and health systems. So there really are there are a lot of commonalities, and you can see that there are certain services that a lot of CBOs generally provide through these contracts. But there are you can see that different health partners have different focuses and different priorities that CBOs can think about when they're approaching partners for contracting.
Interesting. What about COVID? What is COVID doing to all of this?
So COVID we weren't sure exactly what to expect.
Yeah,
We launched,
I would imagine.
launched the last
Yes.
survey in March of 2020, and so we weren't sure what was going to happen then. Right as COVID was kicking off and continuing, we had this survey from June until August of 2021.
Mhm.
So we weren't sure exactly what we would find, but we found that there was an increase in contracting. But we looked at specifically we asked them about what happened because of COVID. And when we look at CBOs that are not contracting but pursuing, 55% or 54% responded that either they had to stop their process of developing a contract, or the healthcare entity that they were trying to partner with had to stop because of COVID, and they had to focus their attention elsewhere. But we also found that 33% of CBOs that were not contracting but pursuing were approached by new and different partners to provide services, but it has not yet resulted in a contract. One other thing, when we look at those CBOs that are contracting, this was what was really interesting. You would expect that COVID and the pandemic would all have negative results on the contracts. What we were finding is that very, very few contracts were actually terminated as a result of COVID. Only about 4% of CBOs that were contracting reported that they had a contract terminated. What we find is that 90% of contracting CBOs modified their services or programs to meet pandemic-related needs. And this is understandable in a different world with all sorts of different constraints and parameters. It's understandable that they would have to modify services or programs. About 53% reduced the numbers served for particular services or programs, and this again is understandable. 46% scaled back the services they provided. At the same time, we find that some CBOs were actually expanding services provided. So 35% of contracting CBOs actually expanded the services they're providing under contract. 32% expanded the number of people served, and 20% expanded to new populations. So COVID is a difficult circumstance for all of us to deal with. But we find that contracting CBOs were able to continue serving, and it's interesting to see that it's not all negative, that there were some positive innovations that came as a result of having to deal with this crisis.
Yeah, I think I loved what you said at the very beginning of your statement. You said, well, we didn't know what to expect with COVID. I kind of laughed because I thought, oh, you haven't lived through a global pandemic before, have you? So, right. It has been really fascinating to see, there have been kind of peaks and valleys in all of this that we're seeing. And your research is certainly reflective of that. Let's get to the nuts and bolts of this, because I think that at its core, as we talk to community-based organizations, we want them to better understand the opportunity that lay in contracting. So let's start right there. Why is contracting important?
Yeah, so I'm with US Aging, but the Senior Research Associate also for the Aging and Disability Business Institute. And I think we talked about that at the beginning. We're the ones who host the Business Institute web series with you all. And our vision is to improve the health and well-being of older adults and disabilities through improved access to quality services and programs. And we see contracting with healthcare entities as the way to do that, because the majority of health outcomes, as I think we talk about a lot, probably in lots of our in the aging space in general, the majority of health outcomes are driven by non-clinical factors, like where a person lives, socioeconomic factors such as access to nutrition, social determinants of health, basically. And so addressing these factors and better meeting the needs of the growing population of older adults that we have in this country is it's important to have community-driven solutions that are driven by what we call cross-sector partnerships as well, including those between the health system and aging and disability community-based organizations, who are the ones who are really the expert at addressing those social needs. And contracting helps to achieve this vision. It helps to achieve the triple aim of improving care, achieving better health outcomes, and lowering unnecessary utilization and costs. But it also helps to support community-based organizations who, as we know, often have flat funding from the government for the growing population, as we mentioned. And so this can help them meet their mission by expanding the populations of people that they serve and the number of people that they serve, as well as improving care through those contracts. But it also helps diversify the revenue sources and really helps with their sustainability as well. So there are many different reasons why this is what we do, but this is our mission at the Business Institute.
Well, what I'm really hearing you say is look, we know that to better serve older adults, we need to address the social determinants of health. We know that the people who do that best are on the ground.
Absolutely, yep.
Yeah, right. And that this is a way to fund those services. And it's for a lot of community-based organizations, they may not really understand the opportunity that lay for them in this to better meet their missions. And so it's important work that you're doing to help them through that understanding. What kind of challenges should they expect to experience? And how are these different at different stages of the contracting process? Because I would imagine as somebody who's worked in the nonprofit world for more than a year or two, it's never easy. So what should we expect?
So when we looked at the results from this last survey, 2021, we asked CBOs about what were their biggest challenges that they faced establishing the contract. And what was the top one was time it takes to establish a contract. It takes longer than what one might want, and that's what we found. Also, negotiation of the price or contract terms. For community-based organizations, they may not have that expertise or the experience of negotiating a price or dealing with contracts. And so this was a challenge when establishing the contract for 34% of CBOs. Having a common understanding of the proposed programs or services, that was a challenge. Timely payment for contracted services and staff turnover in the healthcare entity. Those rounded out the top 5 challenges. One thing that we found that dropped off over time, so a challenge that used to appear much higher on the list, was the perception of healthcare entities about the CBOs. So what did the CBOs, or what were the healthcare entities thinking about CBOs as potential partners? And that has dropped off. That's no longer in one of the top challenges, and that's good news.
Excellent.
That suggests that more and more healthcare entities are recognizing the value of what CBOs bring to a partnership. Mm-hmm. When we look at the CBOs and what challenges they continue to face in the contracting relationship, the number one is negotiation of price and contract terms. So in establishing the relationship, but also in continuing the relationship, continuing to negotiate it, continuing to think about the terms and to navigate that process, that continues to be a challenge. The second one is referrals and volume, and staff turnover in the healthcare entity, just like it was a challenge in establishing the contract. And timely payment for contracted services and denial of claims. Those are the top 5 challenges CBOs face in the continuing contracting relationship. So it changes over time, and it's different when you're establishing versus maintaining or continuing the contracting. But those are challenges that they face, and the Business Institute tries to help CBOs navigate some of these processes and provide services and technical assistance with some of these challenges.
So that kind of gets to the very heart of this. Where do people go to? Where can people learn about the business acumen that this is going to take?
Yeah, absolutely. And as I mentioned earlier, that's what the Business Institute does. We have a lot of free resources on our website. We're not the only source of business acumen work, but we work with a lot of partners as well. And we have a lot of great resources on the site to help develop the business acumen of CBOs. And we use the resources that we've talked about today, the data from the survey, to inform our efforts as well. We look at the challenges that the CBOs are encountering and see what we can do to help. We look at the trends in the data and see what kinds of plans and what kinds of partners CBOs are partnering with and what unique issues might go along with those. Our website is agingandisabilitybusinessinstitute.org, which is long but pretty straightforward. And we have all of our free resources on there as well. We have a number of assessments that you can do to figure out where sort of you're stronger and where you need more help with business acumen in terms of things like financial acumen or your management and things like that. Many different modules to really figure out where you're at. And we also do technical assistance and consulting as well. So those are some places that you can start. And we work with a lot of partners in this space as well. A lot of people are really focused on building up the business acumen of CBOs because this is important work. Yeah, and thank you. There's our link.
That's what I was about to say, is right there on this call, you're going to see the link that, I would recommend that you click on that. We'll also make sure it's in the chat so that you can see it really easily. Knowing where to go to learn is at least 80% of this battle. And so let's start there. Because the opportunity is out there for CBOs to be able to bring new services that we're hearing about, growing services, but also, quite frankly, to figure out how to increase your revenue sources around this so that you can do this work efficiently and effectively. I can't thank you both enough for doing this with us today. My favorite thing about ASA Lives is that they are short and sweet, and they give out so much educational content, and that it is available out there to the world. Our webinars are not quite as short. They are just as sweet. But you do earn CEU credits. So So I would encourage everybody to join us for our next one, as I said, which is going to be January 25th. The topic is going to be primary care at home, how one area agency on aging is bringing back the house call. But again, we run these every single month. You can go directly to our website, www.asaging.org, to see what the events are, which webinars are coming up. If you just click on events right there, you will see it. And you'll see a whole calendar of the webinars that are coming. You can also click specifically on ADBI's page there and see all of their upcoming events and webinars with us, which I think really will help everybody. I always say that when it comes to our webinars, I recommend that you kind of pick a track and go through it for the year, because you really will learn faster that way and gain so much more. So thank you both again, Dr. Graham, Beth. Thank you for joining us today to talk about this and to give this taste of the education that people can get. And again, I hope that everybody has a wonderful, really wonderful weekend coming up. You live where I do, I hope your snow melts. And if you don't live where I do and you don't have snow, I don't want to hear about it. Thank you all. Have a wonderful, wonderful day and a great weekend. And we'll see you back here soon. Bye-bye, everybody.